Hi viewers, hello, welcome back to my channel. My name is Patrick Toya Matope, and on this channel I talk about social work. I deliver social content on social work, and in terms of the information I share with you, it's mostly from my own experiences as a social worker, and also from my own self-directed learning and information which is just out there. But because I'm passionate about sharing such information with you, that's why I kind of started this channel. And thank you so much for tuning in. In terms of today's video, it's going to be a bit unique because I'm looking at something which most people really don't have much information about, but I'm just going to unpack how things are like, especially in England where I'm practicing. And hopefully, if you're practicing in another area of or another part of the UK, please put your comments in the comment section below, and let's start to have a conversation concerning this topic. Before I embark on today's topic, I'm just going to put a disclaimer to say I don't claim to be a guru in social work, but it's information which I'm sharing from my own, experience, like I said earlier on, and as well as from self-directed learning. In today's topic, I'm going to talk about the cost of placing children in care to local authorities. The cost of placing children in care to local authorities, because I think there is so much misinformation out there. I know one of the social workers in my team actually came to me and said, this parent actually said to me, "Oh, so you're going to get a bonus now because you've placed my children in care." No, it doesn't work like that. For your own information, local authorities actually do not want to place children in care at all, but sometimes it is a thing of last resort. It is an option of last resort when everything else has failed, or when everything else has been considered and has not been deemed to be suitable, or has not been deemed to be the best or proportionate course of action to be taken. So when you see a local authority applying to court to place children in care, it means they've tried and everything else, and things haven't been working in most cases, really. So why is that the case? It's because it's quite expensive to be placing children in care, if you look at it. So in this video, I'm going to break down the real cost of placing children in care to local authorities. I'm going to look at four things which you may not have had given a thought about, but it will actually help open your eyes to see that that's why I'm actually emphasizing to say is the option of last resort, because nobody would want to see anyone's child in care, basically. But it is considered, if it is considered to be the best plan for that particular child, then it has to happen. But I guarantee you it is very expensive to place a child in care, rather than that child remaining with the family with support in place, or that child remaining with extended family members with some support in place. When I break down the cost to most local authorities, I'm also going to break it down in terms of giving a comparative analysis, or a comparative figures with other developed countries as well, so that you can actually compare and see that how expensive it is. It's not only expensive in England or in the UK, but it's expensive the world over in terms of placing children in care. So it's not local authorities, are not there to be placing children in care. They are there to give support, but it's considered as an option of last resort if things do not work. In terms of making sure that child remains within their family, then obviously, them being placed in care would be, an option of last resort. So the overall expenditure of local authorities across England, especially if I'm talking about the last financial year, so that I can put everything in perspective. When the financial year I'm referring to, I'm talking about the 2022 to 2023 financial year, because obviously the 2024 year one hasn't been finished. It's going to finish sometime in April. So the 2022 and the 2023 financial year, local authorities in England spent 4.7 billion pounds, in payment to children's social care placements. That's a lot of money, and if you look at that figure, it just tells you that that's not going to be a sustainable plan in the long run. It's not going to be a sustainable thing in the long run for this to continue like that. This figure basically was higher than the initial amount budgeted by the previous Conservative government. So there was an overspend with close to £700 million, which was overspent only on children's social care placements in terms of payment to social care providers who are providing foster placements and who are providing other care placements like semi-independent housing or other placements which are required by children, depending with the level of need for those particular children, especially those who will be in residential care facilities, especially those high placement places. Really, if you look at it, so the high cost of placement is the one which has actually led this figure to actually balloon with more than with close to £700 million over budget. So £4.7 billion is a lot of money. The number of high cost placements is actually increasing each year depending with the need of the children. Sometimes children are placed mainly because they're at risk of further exploitation, or sometimes they are placed because they may be a risk to themselves as well as a risk to others, so they may need to be placed in a facility where they are kind of restrained or their liberties are kind of deprived with what we call a dole's order, if you look at it. So those are very high cost placements if you look at it. Sometimes you've got placements costing in the region of £10,000 per week. There are providers who are offering placement which are costing even £10,000 per week, which local authorities are paying. So if you look at it, really, if a child comes into care while they are, say, 14, 15, and they are placed in a placement which is costing £10,000 a week, you can do the math and calculate how much that local authority would have paid in a month, how much that local authority would have paid, in a year. If it's, say, for example, £10,000 per week, it means in a month they would have paid between 40 to 50,000 pounds, per month for that particular child, only one child. And sometimes how many children would be in care for most local authorities or in your local area, if you look at it really. So these figures has risen sharply from the year 2014 up until 2023. Up until 2024, up until 2025, these figures have risen sharply. The placements which are costing £10,000 now maybe used to cost £3,000, £4,000, but as of now, you have placements which are costing that much. In the year 2022 to 2023, there were 1,500 placements which were costing more than £10,000. So if you go to the website of local government association, this is where these figures are coming from. So this is a local government association of all the directors of children's services, where they will be collating all this information. So I'm talking about if there are more than 1,500 placements which are being paid a minimum of £10,000 a week, you can do the math and see how much money is being paid by local authorities in England per week to some of these placements. So if you look at it, in the year 2018 and 2019, such placements were only 120. There were only 120 placements where children were placed in those kind of placements, high risk placements, and where local authorities were paying a figure of £10,000 a week. But as of now, in terms of the last financial year, 2022 to 2023, there were 1,500 placements like that, and of those placements, they were all full to capacity, which means there were children placed in those placements. So if you look at it, the highest cost of placement reported in that financial year was £63,000 per week. £63,000 per week. You can imagine some soccer players are not even earning that much that much money per week, but that's a lot of money which is being paid by local authorities. So if we are talking of if your local authority has got a couple of children or three in a local authority who are placed in such kind of high level placements where they are paying over £60,000 a week, it means that local authority will be paying in excess of actually £180,000 per week for those 3 placements. That's a lot of money if you look at it. So this is a figure from 2022 to 2023, but I know that the other research which I've done is indicating that I'm not going to name which local authority it is. There's a local authority which is actually paying a placement per week £73,000 as we speak right now. There's a child who has been placed in a specific local, by a specific local authority, where they are placed in a high risk placement, where the local authority is actually paying £73,000 per week. So no local authority would actually rejoice when a child comes into care. It doesn't work like that. Even us as social workers, it doesn't work like that. So it's actually, like I said, it's a plan of last resort, and it's not the best care plan for children out there if you look at it really. So there are various factors which are driving this cost to go up. If you look at it, the contributing factors would be lack of choice in providers. If there are few providers providing a particular level of need, or a particular, who are able to actually meet a high level of need, presenting in a particular child, it means that they can charge more money than, if as compared to their 10 placements like that. It's an issue of supply and demand, basically. If you have got few placements which are able to meet specific needs of particular children presenting with a high level of need, then it means those placements will be very, very expensive. That's generally what it is out there. So the drivers which will which are driving this costs up, we are looking at lack of choice of providers, children exhibiting high challenging behaviors, which are unmanageable in normal foster care placements, which are unmanageable in normal residential care placements, which are unmanageable in normal semi-independent placements, but they will require possibly a door's order and to be placed in a placement where their liberties are actually kind of limited. Then it means those kind of placements, you are talking of maybe sometimes 3-1 or a 4-1, because maybe they are at risk, they are risk to themselves in terms of maybe suicidal ideation, or they are risk to others because of their ideologies which they hold. So there are many things which actually drives this cost to be high. So there are also issues around complex mental health needs which needs to be taken into account as well. So those are some of the things which will drive the cost of placing children in care, if you look at it. One thing I'll also mention, which is point number 4, is that in most cases, emergency placements are even more expensive as compared to planned placements. Emergency placement where, things happen Friday afternoon, you are finishing at 4, and boom, something happens, and there's nowhere else where you can place this child. The cost will definitely be high. It's as good, it's the issue of supply and demand, isn't it? You know how it is. When somebody is selling their thing and they see that you're desperate, they will put their price up, and then you have to fork out because you actually want that particular service. That's how it is out there. And then the last thing is, let's talk about the financial impact all this has on councils. The rising cost of children's social care, means that the money which is supposed to have been spent on investing on staff and so forth, other support services that needs to be in place, like early help, children's centers, youth clubs, and so forth, that money will easily be diverted to paying for, childcare placements. So that's how it impacts local authorities, and that's how it impacts you at a local level where you are living. It just basically means if the local authority is paying, for argument's sake, £73,000 per week for a child who is, in a particular, placement in care, it just means that that local authority may fail to provide other voluntary services, like, for example, early help, may fail to provide other services, like even a children's center. They may not be able to sustain those centers. They may end up selling them because they want to recoup the costs and be able to meet the statutory element of, which is expected of them as a local authority. So these are some of the challenges faced by local authorities when it comes to childcare placements. For example, spending on independent children's home rose by 11% to almost 2 billion in the year 2021 to 2022. And since then, in the year 20 in the year 2022 to 2023, that number is doubled to almost 4 billion pounds, in terms of the money which has been spent. Like I said earlier on already, the previous financial year, the government has spent almost 4.8 billion on, childcare placements only in England. I'm talking about England. I'm not talking about Scotland. I'm not talking about Northern Ireland or in Wales. We're talking about England here. So that's the real cost to local authorities in terms of placing children in care. It's not, a first option when you look at it really. So let me touch a little bit about what other options are there which can bring this cost down, to make sure that the local authorities will be able to bring the cost down and, spread that money to other areas which can actually support, families. We're talking about kinship care. Instead of the child going into care, there could be a situation where a child can be taken care by, the next of kin, people within, the friends and family network really, where if a child lives with relatives, when the parent is unable to care for them, it means this option helps to maintain family bonds for that particular child. It also provides a sense of stability for that particular child. And the local authorities can then use that money to support those kinship carers. And obviously, they will be monitored in terms of making sure that they're taking care of that child well and all that. But sometimes, it comes to a point where, it's deemed by the courts that this child can't remain in the care of the parents, and there's no one else within that family, friends, and network who is able to take care of that child, maybe because there are things going on with them as well, or there are other, other risk factors that are being considered as well. So at the end of the day, that will be the only other option which will be there for those children to be placed into care. And the other option, which is cheaper, is foster care. Obviously, foster care is a little bit cheaper as compared to the other, high cost placements which I spoke about earlier on. But however, most foster carers, they don't earn less than £500 per week for, for the children that they will be caring for. So most of them, it will be, we are looking at cost of between £400 to £800 per week per child. So still the cost is higher if you look at it, because if you are taking care of your own child at home, the government only gives you childcare grant, which is less than 100 quid. But for somebody else who is taking care of a child who is not theirs, they get paid almost £800 per week for that particular child. That's a lot of money. And then we can also look at options like respite care. If things are actually particularly not working, whether there are mental health issues or whatever it's going on in that particular house, whether it's the child or the parent or whoever, there can be, an issue where there is what we call respite care, which is usually used for children living with disabilities. But the respite care can also be used for children who are at higher risk, really, to make sure that we give those parents some chance to recoup their energy and be able to come back with with energy to be able to continue with their parenting responsibilities. So we're just talking of short-term relief here, and some other community-based programs where we have got youth and family centers, preventive services that can be put in place so that we avoid a situation where things escalate to a point where a child may necessarily need to come into care. So we need to be focusing more on preventive work rather than waiting for things to go wrong and then for the child to come into care, because it's quite expensive. The other point which is really, really important to avoid children coming into care or remaining in care for long would be for adoption. If all those children who are currently in care at the moment can be adopted, then it means there is less budget for the local authority, because the local authority won't be paying for those placements anymore, because the child is adopted, is living at home with in a loving forever parent or with a loving forever family, so they will be able to be taken care of. That's one of the permanent solutions which can be there to reducing these costs that we're talking about, because obviously adoption provides a permanent family home for this particular child who cannot return to their birth family. So if you look at it, it offers a long-term stability and a sense of belonging for that particular child as well. So obviously there is post-adoption support that will be offered by the local authorities. So these are some of the things that can also be implemented, or which which we need to be thinking about in order to reduce the cost of child care placements, which the local authorities are actually paying. Right, the last bit in the video, I'm just gonna take about 5 minutes to explain or to give a comparative analysis or a comparative, how England compares to other countries when it comes to placements. So obviously, United Kingdom, I'm talking about in some placements in Wales, or there will be placements which will be costing between £10,000 per week to £63,000. There will be also placements which might cost 1,500. There might be placements which are costing about £3,000. But like I said, in the financial year 2022 to 2023, the highest placement which a local authority paid for a particular child placed at that placement was £63,000 per week. And as we speak right now, there is a local authority already which is paying £73,000 per week for a child placed at a particular placement. Obviously, I'm not going to give the details here. Right. And then typically foster care costs about £800 per week, and or less. That is in the UK or in England. And then United States, how do we compare with United States? Their placements, they will be ranging from $1,500 to $10,000 per month, depending on the level of need as well as the state in which this child is being placed. Because obviously the costs in America, they do vary from one state to the next. However, in foster care, the average would be approximately £1,000 to £2,500 per month per child, which is actually more than what's being paid in the UK. How do we compare with Australia? Australia placements cost between we've got their placements which are costing up to 10,000 Australian dollars per week as well. However, their foster care placements, they are around 500 Australian dollars to 1,000 Australian dollars per week per child, which is also slightly more than what the placements foster carers in the UK actually earning at the moment, or more or less the same basically. And then we look at Canada, where we're talking of ranges between 4,000 Canadian dollars to 12,000 Canadian dollars per month. Sometimes it can even be more, depending with which state that child is being placed in as well. In terms of foster care, we're talking of typically 900 to 1,500 Canadian dollars per child per month. And then in terms of New Zealand, we're talking of between 1,500 New Zealand dollars to 7,000 New Zealand dollars per week when it comes to residential childcare. And for foster carers, we are talking of 200 to 400 New Zealand dollars per week. Right. What are the takeaways? We're talking of high costs in terms of residential care, which is quite expensive, really, depending on the need of the child, the state or the area where the child has been placed, and also what are the issues presenting with that particular child. Obviously, if the child is at high risk, then obviously the cost of that placement will be very high. And obviously there is variation from region to region. If you look at it, even in England also there's variation from one region to the next. I think the most important thing is most local authorities need now to focus more on early intervention to make sure that we put in the support before things kind of escalate or deteriorate to an extent that the child needs to come into care. And I hope with those few words you've managed to grasp something. Thank you so much for watching. If you haven't subscribed, please do subscribe, hit that notification bell so that when I post, you'll be the first person to know. I really appreciate you tuning in, and thank you so much. Enjoy.